much for coming again to our meeting. Do you feel any difference in the previous meetings compared to this one, or what could you?
Yeah, what I can see that it is different and it is much better because first of all, there are very, very good speakers from all around the world. Second, what I can see is that, the Russian guys, the Russian doctors, they're very much interested in plastic surgery. They want to learn, and this is a good thing because there is a lot of enthusiasm. What I have noticed is that the number of the questions have increased, and many doctors, even young doctors, they know what you're talking about. That means that they put a lot of energy, and that means that the quality of plastic surgery in Russia is growing up very fast, and I'm pretty happy about that. And if I can contribute to this, it's going to be a pleasure for me.
You definitely contribute, for sure.
Thank
That's
you.
why we always love when you are coming.
Thank you.
What is the future of the plastic surgery? What do you think in the nearest years? Is it still surgery?
Oh, yeah, I know that there is the huge tendency to go to less invasive operation and treatment. But I have to tell you the truth that it is pretty difficult to obtain the same result through non-invasive techniques. Still, there are many patients who are not prone to surgery and they want some more, let's say, superficial treatment because they can benefit out of that. Especially Russian people, you are very much interested in aesthetics. The women, they take a great care of themselves, so I'm pretty sure that in this country, plastic surgery will keep having a very healthy life.
What is your favorite procedure in plastic surgery? Face, breast?
Face and breast, mainly face and breast. I do less body contouring like liposuction. I do it, but not with the same numbers that I have in face and breast.
For the patients, for the face rejuvenation, what is the optimal procedure in your opinion?
No way, facelift.
Facelift.
Absolutely.
Yeah. What to do with the neck?
The neck is one of my favorite issues.
Yeah, we know that you're expert.
And I've written books and published papers and all that. I think it's one of the most difficult areas in the body, and that is one of the areas where medical treatments can do very little, or at least nothing compared to what surgery can do. But in any case, I think they're useful, so why not? There are certain patients who would never go to surgery, and it's good for them to have some sort of an improvement. But if you really want to see results, you have to go to a neck lift, a surgical neck lift.
What you will suggest to the young doctors who would like to be successful and have a lot of flow of the patients in their clinic?
Just 3 advices. Study, study, study.
Great.
That's it.
Thank you. The next year we will be celebrating 20 years of our company as a distributor in Russia. Tell me, what is your experience as a guru with the distributor companies or with the salespeople? What you will suggest us for the next?
What I would suggest you is just try to invest in creating consciousness in the young doctors. Because the young doctors today will be the doctors for the next 40 years. So the more they know, the better they can choose. And it is important for the industry to create a good knowledge in this doctor so they can have scientific base. And I really think that you can help them because many of them want to learn, and your organization is able to do great things like this meeting in order to help them, and they will be the doctors in the next 30 years.
Well, you one of the doctors who using polyurethane implants in your breast surgery.
Right.
Could you explain us why? Because we have like American way where it's smooth implants, we have European way where it's mainly textured implants, and polyurethane implants is still the argument between the doctors.
Now, if we have to talk about American way, we have to think that our friends from America, they are 14 years back, because for 14 years they could not use a silicone implant. They could just use saline implant. So they're, from this point of view, they have less advantage. Then they cannot use polyurethane at all, so they're limited. They have to use either smooth or textured, and they don't have the possibility. They had the possibility to use the polyurethane, and when polyurethane was in the States, it was a great success. The best doctor used to do it, used to use it, and they were very, very happy. Nowadays they can't, but when I talk to them, they say, oh my God, if I could just use polyurethane. So to me, polyurethane is a great thing, and it's a thing that it's really above all the other sort of implants in terms of quality and of advantages. What's going to be the future? Who knows? You know, science is very difficult to foresee. We don't know if anything else will come out. Up to the moment, I've been working in breast surgery for 35 years. I've been using all sorts of implants. And whatever they say, there is only one implant that can really lower capsular contracture and avoid any sort of displacement and rotation, and that is the polyurethane.
Thank you. I know that you have your hobby and you're an excellent tango dancer, and I remember you did it once a couple of years ago.
Sure.
Tell us, how important for the person, for the doctor, to have sort of hobby which will distress you in your normal life?
You're right. It's not only distressing you, it's when a doctor is only concentrating in his work without having any hobby, the work becomes a sort of obsession. And the work is not to be obsession, it's to be patient, and you have to like it, you have to enjoy it. If it becomes an obsession, like smoking, for example, or like drugs, then that can change your mind and will transform a serial professional in an addicted. That is not good.
So thank you very much for your time.
It was a pleasure.